You've learned a good bit about the mental state of accident victims, but in Section 4, you'll look at some of the psychological effects handling an emergency can have on you. Next, this section gets into the nature of pressure-related injuries and the specific first aid for them, as well as for near-drowning patients. Finally, in preparation for Rescue Training Session 4, you'll learn the specific techniques for emergencies with unresponsive divers at the surface, underwater, and considerations about equipment removal. Any rescue or witness who's involved with a serious accident or emergency may experience critical incident stress in its aftermath. It is an acute mental stress that impairs or overcomes someone's ability to cope emotionally, and is most likely if the patient ended up permanently disabled or dead. Critical incident stress can occur immediately or sometime after the accident, with signs and symptoms including confusion, restlessness, denial, guilt or depression, anger, and anxiety. It can cause behavioral changes that affect mood, appetite, personal interactions, and cause sleeplessness or nightmares. If you experience critical incident stress, don't leave it untreated. Professional counseling helps those with critical incident stress learn to understand and cope with their feelings so they don't become lasting emotional problems. Many of the medical emergencies you might face as a rescue diver are the same as those in all walks of life. But diving also presents a risk of pressure-related injury. As you probably recall, decompression sickness is a pressure-related injury caused by excess nitrogen gas dissolved into body tissues due to pressure at depth. Upon ascent, the dissolved nitrogen dissolves out of the tissues into the lungs. But if dissolved nitrogen exceeds certain limits, it may form bubbles in the tissues that cause decompression sickness by blocking blood flow and causing other damage. Lung overexpansion injuries result when a diver holds the breath during ascent. Expanding air in the lungs causes lung rupture, resulting in air entering the bloodstream as bubbles. These bubbles block blood flow and cause damage by depriving tissues of the oxygen they need. In the field, it's often difficult to distinguish whether a patient has decompression sickness or lung overexpansion injury. Since the first aid is the same, however, it's not important. Therefore, with respect to emergency protocols in the field, the specific cause isn't important, and you refer to both conditions together as decompression illness. Decompression illness symptoms include pain in the joints, nausea, fatigue, dizziness, extreme fatigue, paralysis, unconsciousness, and cardiac arrest. Lung overexpansion injuries result when scuba divers ascend holding their breath, or, though it is uncommon, when trapping blocks air in a portion of the lungs. There are 4 possible lung overexpansion injuries. The first and most serious is air embolism, also called arterial gas embolism. This occurs when expanding air forces its way through the lungs into the surrounding capillaries, with the resulting bubbles flowing to the heart and the rest of the body. If bubbles go to the brain, which they commonly do, they block blood flow and cause stroke-like symptoms. However, the bubbles can cause serious damage wherever they go. If expanding air forces its way between the lung and chest wall, it may collapse the lung. This is called pneumothorax and is characterized by severe chest pain and breathing difficulties. Expanding air can also find its way into the chest cavity between the lungs, causing mediastinal emphysema. This causes difficulty breathing, fainting, shock, and cyanosis, which is blueness of the skin. Expanding air can travel up through the chest and accumulate under the skin around the neck and collarbone. This is called subcutaneous emphysema, which can cause neck swelling, voice changes, and difficulty swallowing. More than one of the lung overexpansion injuries can happen at once, and all are considered serious conditions demanding prompt first aid and emergency medical care. You begin care for a diver with suspected decompression illness, DCI for short, with a primary assessment just as you would any patient. The priorities remain airway, breathing, and circulation. Assume an unresponsive diver has DCI, but give priority to airway, rescue breathing, and CPR if needed. Keep the patient lying down. Field experience has shown that the symptoms may worsen in DCI patients who sit or stand. Refer to the flow chart on the Diving Accident Management Work Slate for the steps in providing DCI care. The specific first aid for DCI is emergency oxygen. Have a breathing patient breathe 100% oxygen from a non-resuscitator demand valve emergency oxygen system. Give a non-breathing patient oxygenated air with the unit's free flow setting. You'll learn the specifics of oxygen system use in Section 5 of this course. Protect the patient from excessive heat or cold, monitor his lifeline, and treat for shock while arranging for emergency medical care. Drowning occurs when someone suffocates from being underwater and cannot be revived. Near drowning occurs when the victim can be revived. Near drowning can result from exhaustion, panic, or other causes in the water. Begin with a primary assessment and rescue breathing if necessary, regardless of the time the victim's been underwater. A breathing patient may have shortness of breath, coughing, or convulsions. Administer emergency oxygen and get the patient into emergency medical care. Note that even a patient who appears fully recovered needs medical examination to prevent possible complications that can arise several hours later. Let's look at the specific techniques for the unresponsive diver at the surface. You'll be practicing these during Rescue Training Session 4. Approach an apparently unresponsive diver, splashing and yelling to get her attention. Make contact and confirm unresponsiveness. Turn a face-down diver face up. You can do this by crossing your arms and grabbing his wrists, like this. Drop the victim's weights and your own to assure buoyancy, and call for help if possible. Remove the victim's mask and regulator and your own if necessary, and open the airway by lifting the chin and tilting the head. Look, listen, and feel for breathing for 10 seconds. Although it's rare in dive circumstances, if you suspect neck injury, open the airway with the chin lift alone, tilting the head only if it's necessary to open the airway. If the diver's breathing, begin towing to safety while monitoring breathing and protecting the airway from splashes. If the diver's not breathing, give 2 slow rescue breaths and then begin towing to safety, giving a breath every 5 seconds. If you miss a breath for any reason, resume with 2 slow breaths. Estimate how far you are from safety. If you're less than 5 minutes away, continue providing rescue breaths while towing the victim there. Get the diver out of the water, perform a heart check and primary assessment, and continue with rescue breathing, CPR, or both as necessary. If you're more than 5 minutes from safety, provide rescue breathing for an additional minute, checking for any movement or response to your breaths. If there are none, the victim is probably in cardiac arrest. Discontinue rescue breathing and tow to safety as quickly as possible for a primary assessment and to begin CPR as needed. If the victim does move or react to your breaths, continue rescue breathing while towing the victim to safety. In handling unresponsive diver emergencies, don't neglect your own safety. Consider the environment and circumstances. You want to begin rescue breaths if needed as soon as possible, but it may be necessary to tow the victim away from a hazard as quickly as possible before beginning. You will learn and practice 3 techniques for in-water rescue breathing: mouth to pocket mask, mouth to mouth, and mouth to snorkel. Mouth to pocket mask is probably the most effective in-water rescue breathing method and has the added benefit of reducing disease transmission risk. Pull out your pocket mask as you approach the victim. After confirming the need for rescue breathing, move above the victim. Place the mask on the diver's face with your fingers under the jawbone and your thumbs on top. Draw the head back to open the airway and give 2 slow rescue breaths. Tow the diver to safety while giving a rescue breath every 5 seconds, monitoring for breathing and protecting the airway. If you don't have a pocket mask, you'll use mouth-to-mouth rescue breathing. At the diver's side, open the airway by running your arm closest to his feet, under his arm and up behind to grab and support the head by hood, BCD, or hair. With the other hand, pinch the nose and press down on the forehead. Use the underside arm to roll the diver towards you for a mouth-to-mouth seal. This is called the do-si-do method. Give 2 slow rescue breaths, then tow to boat or shore, giving a breath every 5 seconds, checking for breathing and protecting the airway. If you're significantly smaller than the victim, or when wearing heavy exposure suits like dry suits, the head cradle position may be more effective. The drawback is it's not easy to roll the diver to you, so you may have to rise above the victim to give each breath. This is more tiring, and you have to be careful to not push him underwater. Another variation is mouth to nose, which is suited to situations in which equipment makes it difficult to keep the mouth open. This can happen with a victim in a heavy dry suit or hood, for example. It's also easier to protect the airway by pinching the nose, making this an option in rough water. Mouth-to-snorkel rescue breathing is used for towing. Note that a snorkel with a self-drain valve won't work. You check for breathing and give the first 2 breaths using mouth-to-mouth, then move above the victim. Place the drained snorkel in the victim's mouth, using one hand to make a seal and pinch the nose, with the other holding the tube against the head, making sure the tip stays out of the water. Tow the diver, giving rescue breaths through the snorkel. With an unresponsive diver underwater, getting the victim to the surface takes priority over everything else except your own safety. Circumstances will affect the best way to handle it, but here are the basic steps. As you approach, note the diver's condition, whether gear is in place or any clues to what caused the accident. Don't stop to do this, just pay attention as you arrive. Position yourself behind the diver. If the regulator's in the mouth, hold it there. If not, don't waste time trying to put it back. Keep the diver's head in a normal position so expanding air in the lungs can escape. It's important to ascend under control. Use your BCD. You may have to vent the victim's BCD as well as your own to control your ascent rate. If the diver is too heavy, you may have to release her weights. Otherwise, you can do that when you reach the surface. If you can't control the ascent, let the victim go and ascend safely on your own. Regain contact and resume the rescue at the surface. As you ascend, think about the situation and plan your next step. At the surface, drop the victim's weights to assure buoyancy. Open the airway, check for breathing, and continue as you already learned for an unresponsive diver at the surface. In some circumstances, you may find it advantageous to remove a victim's equipment, your own, or both. It depends on the circumstances. You should only remove equipment to make the rescue effort decidedly more effective or faster, and consider when as well as what to remove. Equipment removal takes a very low priority, except for removing weights to assure buoyancy and discarding anything that interferes with an open airway and rescue breathing. When you're not far from help, removal slows down getting the victim to safety and additional help. That doesn't make much sense. Just leave the gear on and get there. But if you have a long tow ahead of you, you may go so much faster without gear that you more than make up for the time it takes to ditch it. So in this situation, removing gear from yourself, the victim, or both makes sense. You may need to remove gear for your exit, but again, go with what's fastest and most effective. It's easier and faster to remove equipment in water you can stand in, so it may be fastest to tow the victim there first, then get rid of gear. And think about what you need to keep. If you need your mask to exit through surf, for example, you need to hang on to it. The point is, don't just automatically start removing gear in an emergency. Focus on what gives the victim the best chances and do that. If equipment removal is the right decision, start by thinking about buoyancy. If you and the victim are in buoyant exposure suits, you can get rid of the scuba units. But if not, you may need to keep them so you have the BCD for flotation. The exact order you get rid of stuff isn't important. What is important is that you keep swimming toward the boat or shore and that you maintain the airway. You should always have a hand on the victim's head to keep the airway open. If needed, you must keep giving rescue breaths. Get a rhythm going with priority to the breaths, not the gear removal. Remember also that just because you take something off the diver doesn't mean it has to come off of you, and that what you might ditch in one environment, you'd keep in another. A good example is that while you'd normally drop your own weights, in dry suits you may find you're too buoyant to give effective rescue breaths without them. In that instance, you would dump the victim's weights but keep yours, assuming you still have adequate buoyancy. Keep in mind also that technical diving, with its extensive amount of gear, makes it more likely you'll need to remove it. Many tech diving harnesses fit tightly, and your best bet is often to cut them off the diver.
Congratulations! You've reached Section 5, the last in the course. You've covered a lot of ground to get here. In Section 5, you learn how to complete an incident report after an accident, should you be required to. You learn the specific steps for using an emergency oxygen system in a diving emergency, how to manage an accident scene while waiting for help, and how to exit the water with an unresponsive diver. After an accident that requires summoning emergency medical care or professional help, you may be asked or required to complete an incident report. Factual information from the report can help investigators determine what happened in the hope that future similar accidents can be avoided or emergency personnel can be prepared better. Be aware that accident reports may ultimately be used as legal documents, so it's important to be as factual and objective as possible. Avoid speculating or offering opinions. You may also have reporters ask you about an accident. Be aware that following an accident, you seldom have all the facts and tend to be in an unobjective, emotional state. Inaccurate comments may be taken as fact and create problems for those trying to determine the facts. The best response to media questions is, "An accident investigation is underway, so I'm not in a position to answer questions. Please get a statement from the authorities when they have completed their investigation." As you learned in Section 4, the appropriate first aid for suspected decompression illness is emergency oxygen. This is a community standard because field experience shows that oxygen may significantly benefit a diver with DCI. Prompt emergency oxygen can make subsequent recompression more effective and may decrease the risk of permanent injury. Although non-resuscitator oxygen systems are very similar to scuba systems, they have some special considerations. First, handle them with care and keep them in their protective cases. Oxygen makes things burn rapidly, so extinguish smoking materials and flames before using it. Oxygen equipment requires special lubrication. Never use silicone grease on it. Likewise, avoid contaminating oxygen equipment with oils or grease, including suntan oil. Keep your oxygen system assembled in its case so it's ready to go in an emergency, and be sure to have it professionally serviced as required by the manufacturer. For a breathing diver, responsive or unresponsive, you will use the system's demand system. Open the kit. Slowly open the valve and check the pressure. Inhale from the mask to confirm its function, but don't exhale into it. Secure the cylinder by cradling it in the case so it can't roll or fall, but so you can still read the pressure. Tell the injured diver, "This is oxygen. It will help you. May I give it to you?" Assuming the diver says yes, put the mask on his face and tell him to breathe normally. You may assume that an unresponsive diver would say yes. This is called implied consent. A responsive diver may hold the mask himself, which is reassuring. Monitor the supply. Don't let it run empty on an unresponsive diver. If the patient's very weak and cannot use the demand mask, use the unit's free flow setting and the non-rebreather mask. Attach the mask to the free flow outlet and set the flow for 15 litres per minute. Hold your thumb over the mask inlet until the bag inflates. Tell the diver, "This is oxygen. It will help you. May I give it to you?" After the diver says yes, place the mask on his face. If the bag deflates completely when he inhales, set the flow for 25 litres per minute. Again, watch the pressure gauge to avoid running out while the mask is on the patient's face. You use the free flow outlet also when giving rescue breaths to a non-breathing diver. Have someone set up the system for you while providing breaths. Don't let oxygen interfere with either rescue breaths or CPR if they're needed. Set the flow rate for 15 litres per minute and attach the tube to the inlet on the pocket mask. This adds oxygen to each rescue breath. If the patient begins breathing independently, switch to the demand system or the non-rebreather mask. After you have a patient under care and emergency medical services on the way, you must manage the scene until they arrive. Your priority is to constantly monitor the patient's airway, breathing and circulation, provide rescue breathing, CPR, and, if available, AED defibrillation as necessary and appropriate. Protect the patient against hot or cold. Control bystanders so the area is clear for medical personnel. Pressure-related injuries almost always require recompression in a hyperbaric chamber, so maintain contact with DAN or other local diver emergency services. Give a patient with suspected DCI oxygen until emergency care arrives. If they're delayed or you find yourself running low on oxygen for some other reason, give 100% oxygen or the highest concentration possible as long as you can. This is better than trying to conserve it. If you run out of oxygen, but there's enriched air nitrox available, you can administer that to a responsive diver with a scuba regulator. It may or may not help, but it certainly won't hurt. Be prepared to give emergency medical personnel the patient's name, any significant medical history, the first aid given, dive profile information, any comments relevant to emergency care, and contact information for DAN or other local diver emergency service. The PADI Accident Management Work Slate puts all this in one place. In Rescue Training Session 4, you practiced handling breathing and non-breathing unresponsive diver emergencies in the water. Now let's look at what to do when you get to a boat or shore. Before exiting, you'll need to remove most of your gear and the victim's gear without interrupting rescue breaths. The actual exit may require an interruption though. If so, first give 2 slow breaths, interrupt for no longer than 30 seconds, and resume with 2 slow breaths again. The technique you use for the actual exit will depend on your strength, relative size to the diver, and the environment. The saddleback carry and fireman's carry work well when the victim's relatively small and light. The pack strap carry is one of the most popular because you can more easily carry a larger diver than with the other two carries. But when all else fails, don't worry about doing anything fancy. Dragging someone out of the water is fine when necessary. There are numerous exits onto a dock or boat. One of the most useful if you don't have help is the lifeguard exit, which you can use to bring someone onto a low dock or platform. The ladder carry can help if you must exit to a relatively high point. However, you must be fairly strong for this exit, and so must the ladder. And to get out of the water without assistance, the first rungs of the ladder need to be below water level. Your instructor will have you practice different exits to find the best ones for you and your local diving conditions. Environment and conditions may greatly complicate exits. For instance, exits through surf make it harder to protect the diver's airway. The pocket mask, which you can easily seal, is perhaps the easiest way to protect the airway when dealing with surf. Exits onto rocks, especially with surf, can be the most problematic. The difficulty and risk is such that it's usually worth swimming to a more distant exit point without rocks. If that's not possible, be careful and use the water to carry you and the victim up the rocks in stages. If you expect help quickly, you can avoid a difficult exit altogether by waiting for it to arrive. Help can make any part of a rescue easier, so always ask for it if it's available. Your priorities are providing rescue breaths and contacting emergency medical care. But in some situations, it may be impossible to get out of the water with no more than a 30-second interruption, especially if you're alone. Do the best you can. The victim has more of a chance out of the water with medical services on the way than in it without help on the way.
Congratulations! You've almost completed the PADI Rescue Diver course. After finishing Rescue Training Session 5, you'll complete 4 rescue scenarios in a typical local open water site. As much as you can, treat these scenarios like real emergencies. If you've learned anything by now, it's that there's no one right way to rescue. You have to adapt based on the resources and the circumstances. The scenarios are your chance to learn to think, to plan, to adapt, and to learn in realistic simulated rescues. And you'll discover that you can do things not quite perfectly and still accomplish a competent rescue. You'll find them challenging, sometimes difficult, educational, but ultimately rewarding and worthwhile.
Becoming a PADI rescue diver is an important step that can make a big difference in an emergency. One day, you may be a rescuer in an emergency, but the patient dies or lives the rest of his life with a serious permanent disability, despite all your efforts. It's important to understand that your skills don't guarantee happy endings. All you can do is give the diver more of a chance for a happy outcome, not certainty. Realise that all you can do is the best you can. If in the end your efforts made no difference to the outcome, realise that you did make a difference by giving the patient every chance humanly possible. Don't tell yourself you failed. You didn't fail. Don't tell yourself, if only I'd, because the fact is you don't know and can never know whether anything would have made the slightest difference. Usually the reality is that nothing would have. When you help in a rescue, no matter what the ultimate outcome, you've done something wonderful. You've reached out to help another person, and that's not failure, it's compassion.